Welcome, and thank you for choosing Healtheast Orthopedic Care. We're looking forward to helping you return to a lifestyle you enjoy without joint pain, just like our patient, Nancy Stewart.
I thought about having knee surgery for years, and finally I decided to have both knees replaced. It was just time. I was so limited in what I could do. I couldn't go to a sporting event and walk up those bleachers. I couldn't do all kinds of things I thought I would like to do. I finally realized it's got to be now, when I found myself driving 2 blocks instead of walking. I would go out to the parking lot behind my office and get in my car and drive 2 blocks to lawns and look for a parking space instead of just walking up there, because it was too painful. And at that point I realized that my life was so limited compared to what I wanted it to be, what I hoped it could be, that I decided to have both my knees replaced.
Knee replacements are done for patients who struggle with arthritis, who have exhausted all conservative means of management. And the other key part in indicating someone for a knee replacement is that really the x-ray should show that the cartilage is worn out.
The purpose of this video is to provide you with details about your upcoming surgery and hospital stay, so that you are prepared and know what to expect every step of the way. Some of the topics we'll cover are getting your body ready for surgery, as well as getting your home and your family ready. We'll talk about what will happen during your hospital stay, including how to manage pain and prevent complications. Keep in mind that the information can also be found in your pre-op handbook. This is an extremely valuable reference tool for you and your family. It contains everything you need to know before, during, and after surgery. You'll find a handy checklist at the end of each section of the book with key highlights. And don't forget to bring your handbook with you to the hospital. It will come in handy. One of the most important things to keep in mind as you prepare for surgery is the power of positive attitude. You are a healthy person with a bad joint, and we'll be working together to get you back to your old self as soon as possible.
Take your time.
It's really important to have a positive attitude going into the surgery, knowing, remembering that you're going to be so much better after this, because at the time, it's hard. There's no way around it. This is a big surgery, and it will take time, and it's going to take a lot of work. And at the end of all that, in my experience, it's unbelievably great.
Your number one job is going to be working hard in therapy. This is where you'll learn exercises that will strengthen your body and protect you from further injury. Getting ready for surgery will take some planning and preparation. You will need to think about yourself and your home. Let's start with you. You will need a preoperative physical with your primary care doctor sometime between 3 to 30 days before surgery. While at your appointment, talk with your doctor about your medications. Ask which medications you'll need to stop taking and which you should continue to take. If you're taking medications like Coumadin, aspirin, and other blood thinners, your doctor will advise you when to stop taking these medications. Any changes or adjustments to these medicines should be done only with your doctor's direction. You will need to stop taking herbal medications 7 days before surgery. And be sure to have your medicine list up to date and bring it with you to the hospital. In order to reduce the risk of infection after surgery, you will want to make sure your dental work is up to date. And it's a good idea to think about nutrition and your diet.
Nutrition is important anytime throughout your life, but especially important before you're having surgery and after you have surgery. Before surgery, you want to focus on eating nutrient-dense foods, which would include eating whole grains, plenty of fruits and vegetables, and also focusing on getting enough protein. Oftentimes people don't have a good appetite after surgery, so having a good nutritional status going into surgery is really important. It's also important not to be focusing on weight loss at that time, and just focus on eating healthy foods and getting adequate calories and protein.
Getting ready for surgery also means practicing some simple exercises at home. The stronger you are before the surgery, the quicker you will recover after. Ankle pumps are simply bending your ankles up and down. Quad sets involve tightening your quadriceps or thigh muscle. While lying in bed, use your leg muscles to push your knee down into the bed. Hold for 5 seconds. Straight leg raises are performed by bending one knee, lock the other knee straight, and lift it 6 to 7 inches. Hold 5 seconds and then slowly lower your leg. Repeat using the opposite leg. These exercises will help strengthen the muscles that you will be using after surgery. Perform these exercises at home 10 times each, twice a day. Your nurses and therapists will remind you to do them in the hospital after your surgery. Strengthening your arms before surgery is also important. A simple way to exercise your arms is to sit in a chair with armrests, grasp the armrests, and push yourself up until your elbows are straight. Hold this position for 5 seconds and then lower yourself back down into the chair. Do this 10 times, twice a day. Getting in and out of a car after surgery will require some practice. If the car has bucket seats, put a pillow or a blanket in the seat. You will also want to use a large sheet of plastic, which will make it easier for you to slide in and out of your seat. Back up to the seat, place your hand on the dashboard and on the back of the seat, and lower yourself into the seat. Slide back until you have clearance to swing your legs into the car. Reverse the process for getting out of the car. Bathing after surgery is going to require care and caution. We encourage you to have grab bars installed in your shower area and be sure to have a non-slip mat in the tub or shower. You may want to purchase a bath bench or a long-handled sponge, which will make bathing easier. Most people do go directly home after surgery, and we encourage all our patients to think about making their home a safe place as they prepare for surgery. When you get out of the hospital, you may be using a walker or cane. Make sure cords are cleared out of the way, and you will want to make sure that there are no rugs you might slip on or other tripping hazards. You may want to reorganize a few cupboards so that dishes and other everyday items are easy to reach. Selecting the proper chair to sit in is also important. Choose a chair that has armrest and a firm surface that sits up high. Avoid chairs that sit low to the floor and those that move, such as a chair with wheels or rocking chairs, gliders, or swivel chairs.
Hello, this is Woodwinds Hospital calling.
Health East will be involved in helping you prepare for surgery as well. A nurse will call you in advance to discuss admitting information, such as the date and time of your surgery, as well as to get insurance information. You will receive final instructions a few days before. The nurse will explain food and water restrictions before surgery and what time you should arrive at the hospital. She will remind you what to bring, such as comfortable clothes, two-piece outfits, and low-heeled shoes, such as tennis shoes. You should also bring personal toiletry items, co-payment for prescriptions, and a check for OT equipment. If you use a CPAP machine, you should bring that along as well. You should leave your rings, watches, and other jewelry at home, and remember to remove your rings the night before your surgery. Also leave your credit cards and money at home. You won't need them while you're in the hospital. You will receive instructions on how to shower with the special HippieCleanse cleaner that you have received.
We'd like the patient to take a shower the evening before surgery with 1 packet of cleanser and 1 sponge and wash from the neck down, and then put on clean pajamas that haven't been worn since they've been laundered, and to put clean sheets on their bed. Then the next morning, the day of the surgery, we need them to take a second shower with the second sponge instead of cleanser, and again wash from the neck down, put on clean clothes that haven't been worn since they've been laundered, and come to the hospital.
Patients having their surgery at Woodwind should stop at the Welcome Center upon arrival. St. John's and St. Joseph's patients can report to admitting. When you arrive in the surgery area, your nurse and anesthesiologist will welcome you. All jewelry, including piercings, will be removed. An IV will be started, and you will be given IV antibiotics. Your surgeon will see you and verify your surgical site.
During a knee replacement, we make an incision on the front of the knee to access the innards of the knee. These ligaments on the side are typically left intact, and place a knee component that replicates the normal contours to the femur and the tibia. We have a metal component on the femur and tibia, which is interspaced by a polyethylene spacer that allows for a smooth articulation.
Once the surgery is complete, you will remain in recovery until you are awake and ready to go to your room, where you will be monitored frequently.
Several people will be providing your care, including your nurse and patient care associate. If you need anything, please let us know. Your family will be able to come into your room after the nurses have settled you in. You will be given medication for pain as prescribed by your surgeon. Some of our patients use a PCA pump, which allows for self-administered doses when needed. The PCA pump is for your use only. For your safety, family members, or friends are not allowed to operate this device. It is very important to tell your nurse before pain becomes too severe. Controlling your pain is a team effort. We need you to tell us how you are feeling so we can respond appropriately. Nurses and other caregivers will frequently ask you about your pain and will use a pain scale to help you identify the level of pain you are experiencing. You will also be offered other methods of pain relief, including ice packs that can be placed on your incision. There will be several types of equipment that will be used during your recovery. A drain is used to drain blood and fluid from the surgical area. It will be removed the day after your surgery. You'll be asked to wear a pair of white elastic stockings known as TED stockings and use foot pumps or similar devices to help prevent blood clots. You will be using a continuous passive motion machine, commonly referred to as a CPM. The CPM will help you resume motion in your knee. You may have a catheter which drains urine from the bladder, and it will be removed by a nurse the day after your surgery. And finally, you'll be asked to use an incentive spirometer, which helps to expand your lungs and can help to reduce respiratory complications. Frequent position changes will also help prevent complications. After your surgery, your diet will begin with clear liquids, and it will be advanced as tolerated until you are back on a regular diet. The evening of surgery, you will be assisted to sit up on the edge of your bed and may move into a chair. The day after surgery, you will be up in a chair for all of your meals and will begin attending your physical therapy sessions. For your safety, please always ask for help when getting out of bed.
The role of a physical therapist in the hospital is to help you regain your strength and range of motion and get you moving and out of bed to get you home. We start physical therapy the morning after your surgery. We come to your room and see you bedside and go over exercises and get you up. And then every session after that, you'll be coming down to the physical therapy department by wheelchair, and that'll be twice a day, once in the morning and once in the afternoon. The two important things to remember after knee surgery, first one is to not put a pillow underneath your knee. You want that knee to heal nice and straight as well as bend, so don't put a pillow under the knee. And then the second one is no twisting or pivoting on that surgical knee. You want to keep your toes pointed straight when you're walking and your toes pointed up at the ceiling when you're laying down so that you don't twist or pivot it. During your therapy sessions, the therapist will teach you more exercises to strengthen your leg muscles. You should do these exercises throughout the day while you're in bed and sitting in the chair in the room. And also, it's important to remember that everyone progresses at different rates. Don't get discouraged if you aren't progressing as rapidly as you think you should. It'll come as long as you continue to move and exercise. It's important to take pain medication before therapy so that you're able to work through the exercises and mobility with as little pain as possible. And then before you go home, we'll teach you how to go up and down the stairs so that you feel comfortable getting in and out of your house or anywhere in the community with stairs. And then we'll also provide you with a list of exercises to continue at home, and it's important to perform the exercises 2 to 3 times a day as it will help you regain strength and movement in that knee.
Being in as good shape as you can going into the surgery is really important, both so that it'll be as easy as possible to get the strength back in your legs, but like also in your upper body, because during that recovery period you're going to want to be able to push yourself up out of a chair. And then once you get into physical therapy, or even before, really starting immediately after the surgery, you really need to do as much as you can every day.
Remember that you're choosing to have the surgery because you're in a lot of pain now and you want to have a better quality of life. And we can help enhance that when you're here at the hospital to show you that once you go home, you're well on your way to recovery, even in the hospital. And anything that you can do for yourself and helps yourself to be independent and to be safe is a wonderful thing.
Occupational therapy is also an important part of your rehabilitation. The role of the occupational therapist is to help you perform your daily activities, such as dressing and toileting, while following the restrictions that are set by your surgeon. The occupational therapist will see you in your room either the first or second day after your surgery. You will continue to work with your occupational therapist each day until you are discharged or when you have met your therapy goals. We will assist you with dressing and using adaptive equipment, such as the reacher, the dressing stick, and the sock aid. We will also work with you on activities with emphasis on simulating your home environment, such as getting in and out of a car and a bed, safe kitchen mobility, and using the tub, shower, and toilet. You may need an elevated toilet seat for comfort after your knee surgery. We will help you problem solve any specific concerns that you may have about returning home. We can also address any concerns you have about sex after total joint surgery.
Before you are discharged, we will assist you with obtaining a walker, crutches, or a cane if you do not already have one, give you a home exercise program for you to follow, recommend outpatient or home physical therapy, and assist you with obtaining the equipment you may need for your activities of daily living. Our goal is to help you regain your independence and get you back to doing the things you like to do.
In my experience of having had 2 knees replaced, in the long run, it is really worth it.
Preventing complications is an important focus during your hospital stay. Like pain control, this is a team effort between you and your caregivers. To prevent infection, make sure you take care of any dental work before surgery and use the HippieCleanse scrub in the shower before surgery as directed. You will be given antibiotics before and after surgery, and your nurse will teach you how to change your dressing and keep your incision clean and dry. Eating a healthy diet also helps prevent infection. To reduce the risk of blood clots, we want to make sure that you are up and moving as soon as possible and increase your activity level each day. Your surgeon will prescribe a blood thinner and will discuss how long you will continue with it after surgery. Wearing your TED stockings and performing your leg exercises several times during the day will also help prevent blood clots. Surgical patients are often at risk for pneumonia due to the use of anesthesia, pain medications, and the lack of mobility. So to reduce the likelihood of pneumonia, we will have you do some deep breathing and coughing, fully expanding your lungs every day. You will be using a spirometer to help gauge your lung capacity. And again, we will want you to increase your activity level every day. Finally, to avoid poor function of your new knee, be sure to use your CPM machine and do the exercises that you learned in therapy. Keep in mind that strengthening is as important as bending. As far as bathing goes, no tub baths until instructed by your surgeon. For the first 7 days after your surgery, you may shower with your incision covered. Place plastic wrap over your incision and secure it with paper tape. After 7 days, you may shower without covering the incision if it is completely dry and there is no drainage coming from the incision. Do not scrub over the incision line. And when you are finished showering, use 2 towels to dry, one for the incision and one for the rest of your body. Do not use any lotions or gels on or around the incision. If you have steri-strips across your incision, do not pull them off, let them fall off on their own. Redress your incision with a light dressing. Once you meet your goals in physical therapy, you will be discharged. Continue your exercise program as described by your therapist. Your surgeon may also order other outpatient or home physical therapy. A social worker will help you with those arrangements.
The day after the surgery, the social worker will come in your room and meet with you and try to get a sense of what your home environment is and what kind of support you have available to you after your surgery. From that point, with that information, we will then develop a safe plan for you to leave the hospital. We would encourage everybody before they come into the hospital to check their medical insurance to find out what kind of benefits they have and what kind of out-of-pocket expenses they might incur while being here. If your doctor orders some home physical therapy or outpatient physical therapy, we will make those arrangements for you. If sometimes people are not able to go straight home and may need to go to a transitional care unit, and we will help you with that process in finding a safe place for you to go to continue your recovery after your hospital stay.
I am so glad I had this surgery. I'm glad I had it now rather than waiting any longer. I think I, like everybody else, waited for years to have this surgery from the time that I started having, limitations on my life, both pain and limitations on movement. And I'm so glad that I did it now. I've become a person who actually uses stairs on purpose. This is amazing to me. I am an avid flower gardener, but for years I couldn't do it because I couldn't stand, I couldn't walk, I couldn't kneel, and now I can work in my yard for as long as I want. It's wonderful.
We hope this video has been helpful. If you have any questions, please feel free to call our orthopedic educator at 651-326-3205. Thank you.